Hi, and welcome to Altered Elimination, Gastrointestinal, Biliary, and Renal. At the bottom of this PowerPoint, you will see the chapters to focus on. This comes from 2019. This is the Medical Surgical Nursing 9th edition. So these chapters are referenced to the 9th edition. Now here's our Module 8 that we'll be covering. I want you guys to make sure you review the digestive organs. That's found in chapter 52. The mouth, the pharynx, esophagus, stomach, and small intestines, large intestines, and also your liver and gallbladder. On the side are some chapters for you. Also, make sure you review your anatomy and physiology. In lecture, we did use Kahoot! To go over just briefly over some things that I felt that was important for you to know, but I want to make sure that you do review this on your own as well. As we continue to review your syllabus, I want to make sure that we understand A, B, C, D, and F. Define and describe the terminology. Make sure that you understand these terminologies, and it's found in your chapter readings. Make sure that you understand how to inspect and auscultate vowel sounds. We've gone over that. We did go over this terminology in our Kahoot! App also, but Borgamus and Brewy. Excuse me. So I want to make sure that you understand your assessment skills. If you have any questions with your assessment skills, please let me know. As we talked yesterday about different diagnostic tests, we talked about barium swallow, endoscopy, GIs, all of these tests here. I also supplied you in class with some videos. So I will try to incorporate those videos in this lecture, or if not, at least give you the links to the videos so you can see them. And I will try my best to put the links of the videos in the PowerPoint so you can have those at your discretion whenever you would like to use them. This is a very big module to cover, but I want to make sure you're doing your reading as well as I continue to guide and reinforce. So when we're dealing with the bowel, I want to make sure you go over constipation, diarrhea, hemorrhoids, irritable, appendicitis, peritonitis, and gastroenteritis, excuse me, and so forth. And also understand the lab values that go with these and understand what we do as nurses at the bedside. So we want to apply this knowledge to what we're actually doing to our patients. For those who haven't, I want you to go over here under clinical objectives and look at over here, describe the correct techniques and insertion. So if you haven't gone to the skills lab, I will highly recommend you go into the skills lab and practice putting in an NG tube. So you can understand that. So when it's time to do it in a clinical setting, you will have practice. And when I say practice, not just going in, getting it signed off, but you need to go back and practice more and more and more. And for those who I announced the hours yesterday after class, if you have not met your hours, please go to the skills lab and start working on your hours. Our semester is ending soon. And while you're in the skills lab, I want you to ask the instructor so you can understand the difference between a bolus, continuous, and intermittent feeding. And also describe the techniques and rationales associated with checking for gastric residual. Very important. How do we know if our patient is digesting the food that they're getting? So we do that by checking for residual. We will also, according to your syllabus, we will talk about Objective 5, which we will discuss anatomy and physiology of the urinary system. I do want you guys to go over your own anatomy and physiology, what you've learned and what you can bring to the nursing program from your previous classes. And then as we end, I want you to be able to do a health assessment on the urinary status. I want you to be able to, and we talked about this in fundamentals, when a patient is having problems, I want you to be able to do a good assessment. Look at the urine, the color, the amount, any odor, Any difficulty with urination? Are they going a lot? These are questions that we need to ask our patients and ourselves when we are completing an assessment on our patient. Is there any blood in the urine, any pus? Are they having flank pain, low pelvic pain? We need to ask all those things. And then also include in our physical assessment 1, 2, 3, and 4. And also 5. You're looking for bladder distension, okay? Also in your chapter readings, you're going to go over objective 7. I want you to just be familiar with all the different type of exams we do regarding our urinary system. So different types of exams. We have the pyelogram, the cystoscopy, urinalysis, and all the others here. And then when we look at these exams as a nurse, is there anything we need to tell our patient? Any patient teaching we need to do? What they should expect in an exam, what we should be looking out for, any lab tests we should be looking for. Are they on the right medications, antibiotics? We are the patient advocates. So when we're looking at different exams, patients coming back, is it something that we need to notify the doctor about? And so forth. And when I say patient is coming back, I'm speaking of like coming back from a procedure. Maybe the patient left their bedside by gurney or wheelchair and went down for a procedure, i.e. intravenous pyelogram or cystoscopy. And they came back and maybe there were significant findings, and maybe we need to notify the physician if the radiologists haven't done so already. Maybe the urinalysis came back and the final results of the urine culture, or maybe their labs came back. And if there's something significant, as a nurse, we need to notify the physician and also do our assessment on our patient. As we continue in Module 8, I want you to focus on all these letters here. Make sure that you understand it and you're able to verbalize it. Look at your clinical objectives and what you should be doing during at the bedside. Okay, but I want you to make sure you focus on all of these. And I won't read them off to you one by one, but I want you to make sure you focus on these. Okay, look at this. Define and describe 6 types of urinary incontinence. You will find that in your chapter readings. As we continue on in Module 8, Objective 9, this continues with the previous objective. That was Objective 8. Now this is Objective 9. Digestive enzymes. We talked a little bit about that in class with our Kahoot! App, but also I want you to read on that. It's not a big section of reading, so I want you to read on it and focus on it, okay? Hormones associated with the GI secretions, your stomach, the pancreas, small intestines, and enteric neurons. With the GI system, we're also looking at discuss disorders of the esophagus and our stomach. So we know with gastritis, we can have different types, erosive, corrosive, atrophic, and so forth. The drugs and the classifications of what these patients are taking to help out with what's going on up here. Then also we're going to talk about duodenal ulcers and peptic ulcers. All of this information is found in your chapter reading. I'm going to go over a PowerPoint with you, and I'll probably reference some chapters in the PowerPoint as well. As we continue, here's more. Just different types of things that's going on in that GI system, the different ulcers that we're having, and other things that can happen. The bleeding, dumping syndrome, stomatitis, mucositis, dysphagia. So, and the Billroth procedure. I have a video to show you actually exactly what they do during that procedure. So I want you to know, I know it's a lot of information. We're going to cover more as you go out throughout your nursing program. So remember, I'm not trying to get you to know all the detailed, intricate things. I do want you to know about the knowledge of it and the pathophysiology and tests that are involved, and also what we do as nurses at the bedside. Now what we have here is some of our therapies that we use. Now remember that we were talking about those ulcers and things. So antacids are used, nystatin is used, and other medications are used. Nystatin is used a lot when you have the fungus growing in the oral cavity. Antacids are used a lot, and I'm sure you guys already know, to help decrease that acid buildup in the stomach cavity. I wanted to reinforce that you are responsible for the anatomy and physiology and assessment learned from your A&P class. Fundamentals also has a good resource, and as you see, there are some good resources in your MedSurg book as well. Let's get started. Gastrointestinal system. Let's look at this slide and just do a quick little overview of where things are located and situated. As you read, I want you to pay attention to some of these terms. We went over Bruits yesterday, scaphoid abdomen. Look at that abdomen and see how it is. Read here and now compare it. Here's more terms. These are simple terms that you should be aware of. This picture is referring to your melena, black tarry stools. Flatulence, excessive amount of gas in the stomach or intestines, and so forth. Okay, understand what burping is. You may have someone tell you the medical terminology. So let's look at some procedures, and here's some page numbers, and I just went over your syllabus also. Here's some page numbers that you can go to in your book or your syllabus. So we talked about the barium swallow. What is it, as you read these slides, that we need to tell our patients when patients are going down for barium swallow? What is it? Because we're, as nurses, not doing the barium swallow. We're providing care for the remaining of our patients on the floor. But what kind of teaching can we give our patients? Okay, we can say it's generally safe. You know, allergic reactions can happen, or anaphylaxis reactions can happen to any barium or any medications that are happening with the patient. So what should we have? We should have the medications ready for any type of reactions that could possibly happen. Some patients might need some Benadryl. They might need some Solu-Medrol. They might need something to help them counteract the allergic reaction. And of course, this is what we're going to reinforce with our patients. Constipation may happen. The color of the stools may change to that clay color. We're going to encourage fluids, okay? And strong possibility, aspiration. So, and if that happens, the physician will know, and we will notify the patient once the patient is awake. Here's more information regarding the barium swallow and things that we should be talking to our patients about, okay? Remember about the table, it must be tilted at various angles. Remember the video I showed you, and I'll include more videos. But remember that, because the patients won't know that they're going to be on a table and it's going to tilt. And they're going to drink as the doctor tells them to swallow, so we can see it on the x-rays. So we need to tell the patient about that. Inform them, educate them. Here's more things we need to do. Remember about the chalky white stools, or light colored. It's going to last for 1 to 3 days. Encourage them to drink lots and lots of fluids. Here is an example of the patient drinking. So here we are here, and then you can see the barium go down. Let's talk a little bit about the endoscopy and colonoscopy. So here we are. The doctor is able to visualize the inside lining of the digestive tract. So with endoscopy, they're able to go down with this flexible fiber optic tube. It's very sensitive. The tip of the tube is very sensitive, and it can be broken very easily. It's sterilized between patient and patient. It's nothing that is disposable. These are some of the risks that are involved in an endoscopy or colonoscopy. With that being said, we do place our patients on a cardiac monitor. We do have a team at the bedside, the doctor, and there's an LVN and also an RN and also a crash cart nearby. Look at this slide and look at the very first one, informed consent. All the others are very important too. Just a quick picture of the doctor doing endoscopy. Please read after endoscopy what we need to do for our patients. And these are considered emergencies after endoscopy, and we need to make sure we notify someone immediately.